My name is Kristen Howell, and today I will be discussing what interprofessional education, or IPE, is in pharmacy. The learning objectives for this presentation include being able to define what IPE is, being able to understand the importance of IPE, describing examples of IPE, identifying what IPE is not, and listing barriers to IPE. Before getting to learn all the ins and outs of interprofessional education, or IPE, it's important to understand a definition of IPE. IPE is interprofessional education, where educators and learners from two or more healthcare professions can learn and train together to provide patient care in a collaborative way. So next, let's talk a little bit more about what is involved in IPE. So the idea of IPE has actually been around for quite a while. It's been around for more than 50 years. However, it's not something that's necessarily always been put into practice in schools or in different training programs. In fact, traditionally, healthcare professions have been trained only by the faculty or the professors from their program and or the same profession. So for example, pharmacy schools may have their students being trained by different pharmacists or only faculty from that profession. Same for dentists, doctors, and so on. However, there was some interest that reemerged about this idea of IPE in the early 2000s after the Institute of Medicine issued some different reports that was showing that there was a decrease in some different patient safety events. For example, they were finding there were a lot of medication errors that were being made. It was at this time that it was noted that different healthcare professionals needed to start working together to try to help improve patient care. Actually now, in different schools or medical professions, there is some type of component where professionals are expected or encouraged to be working to collaborate with other healthcare professionals. So why even have IPE? The goal of IPE is for trainees to learn to function as an interprofessional team while in school or training and transition this practice and knowledge into their future practices or careers, with ultimately providing patient care as a part of a team-based approach to help improve patient outcomes. An interprofessional team can be composed of many different members of healthcare with many different backgrounds. The thought of this then is that each profession can come to the table and they will be viewing the patient and assessing the patient from their point of view. Then the idea is that working with these different professions to provide patient care, they can bring their perspective and communicate it to the team to ultimately create a shared decision or plan of care for a patient. An example of how this is applied in real life is through a patient-aligned care team or PAC model through Veterans Affairs. What's important to know about IPE and this focus is that it can differ from what traditional medicine has been practiced in the past, which may be where a physician may be coordinating all the services, and maybe there might not be pharmacy involvement or nursing involvement or other healthcare professions involved. In these types of settings, it may lead to a lack of collaboration and potentially some conflicts in patient care as well. An example of IPE is actually right through Concordia University of Wisconsin. In their School of Pharmacy and other healthcare professions, this is something that is practiced. They actually have an entire page on it if you go to the Concordia website. And you can actually find out that you can find out their objectives and their goals. Their objective for this program is ultimately to provide students opportunity for growth. They try to give different interprofessional opportunities so they become more competent. They try to provide opportunities so the students can get different team building activities in, so they can be working to collaborate with each other. And they also have many different interprofessional practice opportunities. They have different missions, visions, and objectives. They ultimately are looking to get interprofessional education out there for their students and their different healthcare training programs. An experience I'd like to share from this example is that I actually was a student in the pharmacy school at Korea, and I remember going through the interprofessional education, which was a great opportunity. We would get to meet at different times throughout my schooling there at the school, and we would meet up with multiple different professions to have either different case discussions or practice real life scenarios. So I remember meeting up, for example, one of the nights we met up after school and we had a few different patient cases to meet up with where we were working with pharmacy students, nursing students, physical therapy students, social work, physician assistants, all different types of healthcare students. And we came together and discussed patient cases and kind of what we thought our role was in the team and how we were ultimately going to care for these patients. Another example of an interprofessional education program that we got to do when I was in pharmacy school is we actually did a mock code with other trainees. So I remember meeting up, the pharmacy students met up with the nursing students and we went to a mock code. So all of these are great examples of interprofessional educational opportunities where different healthcare professions are coming together and they're practicing and collaborating together to be able to provide care for a patient. Another thing to be aware is that IPE is something that's not only done in education or at schools, as it's actually can be done in different health systems. So different healthcare systems across the country and different training programs may actually provide IPE to their employees. An example I like to give is through the Boise Veterans Affairs Medical Center. They're actually a hospital that was identified in 2010 to try to improve primary care education in the United States. They were part of they were one of the many other VA systems across the nation that were given an initiative to create centers of education where their focus was to try to create an interprofessional collaboration. And they did this through their VA primary care settings to try to develop and test different innovative approaches to try to help prepare different healthcare trainees to be prepared to practice in the 21st century. What's really exciting about the programs such as the Boise VA is that they can take different trainees and they'll have them training and working together. That way, they can ultimately go out once they're done with their different trainings and educations, and they're used to practicing with other healthcare providers to provide care to patients. So this practice that they get in these settings will apply directly to their future careers going forward. So we're thinking about what IPE is. It's good to point out what IPE isn't. IPE is not when students from different healthcare training programs are receiving the same educational experiences without education with different professions. So, for example, if you've got nursing and physician assistant students receiving a lecture from a pharmacist, but there's never any discussion or collaboration, that's not going to be an example of IPE. Another example of what IPE isn't would be a faculty member from one healthcare profession teaching a different healthcare profession. So, for example, if you think of a physician or a medical doctor teaching a pharmacy student, that wouldn't be considered IPE. Another example of what IPE may not be would be practicing in a patient care setting led by one healthcare profession, and no shared decision making was made from any other profession in the group. So an example of this may be a nurse practitioner who may be the primary care provider for a patient. They may be the only person making all the decisions for a patient's care. But in this type of setting, maybe they're not including their nursing staff, social workers, or pharmacists on their team to help with anything. It's only the nurse practitioner making the decisions. So from the information I've presented so far, you may wonder, is there even evidence out there to support this interprofessional education practice? So there's actually been quite a few studies out there looking at the value of IPE. A specific one I'd like to review here is a systematic review of 13 different IPE programs was determined to have positive results When healthcare professions are tested in other professions, roles, interprofessional care, geriatrics, and quality improvement methods. Learners in these settings were also found to have more positive attitudes towards other healthcare professions because of this. So learning a little bit about interprofessional education, you might wonder, well, why isn't this something that's being done everywhere, or why maybe haven't I heard of this before? Well, there may be some barriers actually to implementing this, especially in different schools or even in different practices across the United States. There may be different barriers that may be encountered from different people across an organization, whether that may be administrative staff, different faculty, or even different students that might have some barriers up. In addition, there might be some scheduling barriers that may be up. For example, I can remember just going through the program at Concordia, and that often we had to do our IPE events after all of our schooling because we all were going to class during the day. So if it's difficult or hard to schedule around a bunch of different programs or people's schedules, that may be a barrier. Also, there may be the barrier that people just might not perceive that there's any value in reviewing different interprofessional education. However, as people go through and do the different educations, I think it's realized quickly the benefits and the value of interprofessional education, but if that's something that's not currently practiced at a facility or at a school, there may just be some value that's not really perceived at first. And like a lot of other things, a barrier of just having lack of resources. If you don't have people, time, places for any of these IPE events to occur, then you may not be able to implement IPE. So in conclusion, interprofessional education is a great opportunity for different trainees to collaborate with other professionals to practice figuring out how to work together. So ultimately, when they get to be a provider or go out to be practicing in the career field that they went into, they're already aware and they know about other healthcare professionals on their teams and what their roles might look like. They may also have better and more positive attitudes towards these professions because they have some experience working with them in school. Ultimately, it's going to be there to give them this collaborative background so they can provide better patient care. And to end, here are my references for today's presentation. Thank you for your time.